Alrighty guys, good to finally be back. I'm Dr. Leo Venus and today I am checking in from LA, here in California, USA. I'm actually here visiting my brother John and we have some exciting projects we are working on that I'll tell you more about later. But for now, if you're new to this channel, make sure to click the subscribe button and the notification bell next to it so that you are notified every time I make a new video. For today's video, we are going to be talking about a certain subject which was asked over at Patreon. And by the way, I recently created a Patreon account and the link to that is in the description box. And the question that was asked by one of my dear patrons was, once you become insulin dependent, can type 2 diabetes be cured or just managed? Now, before we answer this specific question, let's do a quick run through type 2 diabetes. This is how this disease has been taught to medical professionals for many years. Type 2 diabetes is a chronic condition that affects the way our body metabolizes sugar. It used to be known as adult onset diabetes, but today more children are being diagnosed with the disorder, probably due to the rise of childhood obesity. There is no cure for type 2 diabetes, but losing weight, eating well, and exercising can help manage the disease. If diet and exercise aren't enough to manage your blood sugar well, you may also need diabetes medications or insulin therapy. Type 2 diabetes develops when the body becomes resistant to insulin or when the pancreas is unable to produce enough insulin. Exactly why this happens is unknown, although genetics and environmental factors such as being overweight and inactive seem to be contributing factors. So there are a few issues with this way of viewing type 2 diabetes. Firstly, it emphasizes no cure and chronic, while there is actually ample evidence suggesting that this is a condition that can indeed be reversed. Secondly, the behavior change and the lifestyle factors that are actually mentioned here can be part of that solution in order to completely reverse this condition rather than just manage it. And thirdly, even though we might not know absolutely everything there is to know about type 2 diabetes, it is crystal clear that it is an unhealthy Western lifestyle that causes this disease rather than factors that are outside of our control, such as our genetics. The mainstream medical view of type 2 diabetes propagates an attitude of hopelessness. It causes confusion around the true cause of the disease and ultimately disempowers individuals from achieving their best possible outcomes. To me, this is especially disappointing as I know that for the majority of people, we are it. Doctors are seen as their best hope for finding their health, and in this instance, we are miserably failing. Despite the growing evidence that reversal is possible, achieving reversal is not commonly encouraged by our healthcare system. In fact, reversal is not a goal in diabetes guidelines. Specific interventions aimed at reversal all have one thing in common: they are not first-line standard of care. This is important because there is evidence suggesting that standard of care does not lead to diabetes reversal. This raises the question of whether standard of care is really the best practice. So what do we do then if we have type 2 diabetes and we want to reverse this condition in order to avoid all of the complications that are associated with it, such as eye disease, kidney failure, nerve damage which can lead to amputations, heart attacks, or if you have pre-diabetes and you want to avoid getting the full-blown disease? Well, since this condition is caused by an unhealthy lifestyle, the natural solution is a healthy lifestyle. And one of the most important factors in a healthy lifestyle is diet. And not surprisingly, the diet that has been shown to do the best in terms of preventing and even help treating and reversing type 2 diabetes is actually a whole food, plant-based diet or a healthy vegan diet. The majority of the biggest, most well-respected health